Health Officer, Dr. Maura Rossman. Dr. Kate Hetherington, President of Howard Community College. Dr. Shafiq Ahmed, Interim President of Howard County General Hospital. Jackie Scott, Director of our Department of Community Resources and Services. Dr. Michael Madarano, Superintendent of our public school system. And finally, Fire Chief William Anashevsky. Again, thank you to the press that are here today and to all who are joining on Facebook. After all the remarks, we will open it up to questions from the press. And now, County Executive Calvin Ball.
Thank you so much, Angela. Good afternoon, everyone. Today, I want to first remind you all that we are still very much at the height of this pandemic. COVID-19 has now affected more than 13,400 Howard County residents, and over the weekend we reached the grim milestone of more than 200 deaths of Howard County residents. We must continue to practice the mitigation efforts that we all know are effective. Washing our hands, wearing our mask, and maintaining physical distancing. To get through this, we also must keep working together, especially during this vaccine rollout. Today, I want the message to be clear. When Howard County receives more vaccine, we get shots in arms immediately. We remain focused on this historic effort to get everyone in Howard County vaccine as soon as possible. I want to thank Governor Hogan for advocating to the federal government on our behalf to get more supply for the entire state. Our vaccination efforts depend upon this advocacy and federal government action. Since vaccine became available on December 23rd, Howard County has requested 14,600 doses, and we have received 52% of that request. As of last night, more than 7,000 doses have been administered in Phase 1A. Of our 7,600 doses received, and today we will have gone through 100% of that allocation. Prior to the governor's announcement last week, all of the vaccine appointments we have this week were already scheduled for those in Phase 1A based upon the number of doses that we have available. Phase 1A includes all licensed healthcare providers, correctional officers, law enforcement agencies, and frontline judiciary staff. We estimate that up to 15,000 people constitute Phase 1A here in Howard County. We have been preparing for Phase 1B simultaneously. When the governor announced Phase 1B last Thursday, we opened up a pre-registration process immediately. After receiving more than 12,700 pre-registrations, we made operational adjustments quickly, and I'm very pleased that our health department will begin vaccinating registered seniors today. Phase 1A will also continue as a rolling phase. Today, Dr. Rossman has requested 20,000 vaccines to support this effort. As you recall, the state includes those ages 75 and over, those residing in assisted living facilities or special needs group homes, developmentally disabled populations, continuity of government, and K-12 teachers, education staff, as well as child care providers, all in Phase 1B. Governor Hogan made it clear that we are to prioritize our residents ages 75 and older. It is estimated that there are more than 20,000 adults here in Howard County ages 75 and older. And today, we are here in the Howard Community College Gymnasium to announce that this site will be operative in 6 days to further support our expansion. While our current operation can accommodate the current level of supply given from the state of approximately 3,000 doses a week, this site will allow us to vaccinate at least 1,500 additional people per day once we receive the additional vaccine from the state. I'd like to thank my friend, Dr. Kate Hetherington, president of HCC, for her support and coordination to make this possible. I'd also like to thank the students and staff who are volunteering their valuable time to help operate the clinic smoothly right here on campus. The HCC vaccination clinic will begin operating Monday, January 25th. Later, you'll also hear from Director Jackie Scott, who will discuss our tremendous outreach efforts to ensure that all who are eligible will be able to get the vaccine. In addition, I'm pleased to announce that we are also leveraging our mobile integrated community health program to launch strike teams in our community, and our fire chief, Bill Anashevsky, will provide those exciting details. In preparation for Phase 1C, we are following the governor's priority to focus on residents ages 65 to 74. This pre-registration is already live on the health department's website, and since Thursday, we have had more than 12,500 residents sign up. Phase 1B also includes our K-12 educators, and we are working collaboratively with our public schools to open and run vaccination clinics specifically for their staff. As a father of children in our public school system, I understand the concerns that many parents have in Howard County about sustained virtual learning for such a long period of time. I want our kids and educators back in school buildings as soon as safely possible. And I'd also like to thank and acknowledge our Superintendent, Dr. Madarano, who, with our Board of Education, are key partners in getting all our kids and educators safely back in schools as soon as possible. You'll hear more about the operations for vaccinating our school staff from Dr. Rossman and Dr. Madarano. As for our non-public school educators and child care providers, pre-registration will be available on the website, and we are communicating directly with these providers so that they can also be prepared for success. In total, it's estimated that there are nearly 100,000 people included in phases 1A, 1B, and 1C here in Howard County, who will be eligible to receive vaccine in the coming weeks. Please remember, all who are vaccinated will need 2 doses. What we have requested will support both first and second doses needed. We will continue to work with the governor to advocate to our federal partners. Our expanded operations will allow us to vaccinate as many people as the supply allows. And when we get more supply from the state, we have been and will continue to be ready to efficiently and safely administer the vaccine. I recognize the question on everyone's mind is, when will I be able to get vaccinated? As the governor said last week, not everybody is going to get an appointment until we have enough vaccines, and we currently do not have enough vaccine. This is why we need both your help and your patience. If you know someone who is 65 or older and lives in Howard County, please direct them to pre-register at vaccine.howardcountymd.gov. Again, that's vaccine.howardcountymd.gov. So the health department can contact them in the coming weeks to schedule their vaccine appointments. We will also be expanding this week on our website to everyone who is eligible in 1B. This is an extraordinary effort, and we must be united toward the goal of getting us to herd immunity as soon as possible and saving as many lives as we can along the way. To reach that goal, everyone working together will be critically important. Thank you very much.
Thank you, County Executive. And now we'll hear from Dr. Maura Rossman, Howard County's Health Officer.
Good afternoon. Thank you, Angela. Thank you, Dr. Ball. The Health Department has now entered Phase 1B of the vaccination process. In addition to the healthcare providers and first responders, we began just this morning vaccinating those who fall into the 75 and up age group. As the executive said, we believe that Phase 1B has an estimated 30 to 35,000 people in it. That's just 1B. In preparation for this and subsequent groups, we have been planning for the expansion of our clinic operations, which up to this point has been at the Ascend 1 building. Accomplishing this expansion required the addition of staff to support the effort. To do this, we are drawing upon our own staff and working with partners like Howard County Government, the Medical Reserve Corps, Howard County Public Schools, and if needed, the National Guard, amongst others, who will serve in the variety of positions required to run a mass vax clinic. We are fortunate to have the support of so many to make this and eventually other clinics come to fruition. We will need to accomplish our goal to have simultaneous clinics operating every day until we get everyone vaccinated. The addition of a clinic at Howard Community College will allow for approximately 10,000 first vaccinations each week to be given at this location alone. This number will grow to 20,000 when we begin second doses. We will continue to operate the clinic at Ascend 1, which can administer approximately 3,000 vaccinations a week. And then we will expand it to additional sites to vaccinate the pre-K through 12 staff and educators. It is important to remember that the number of vaccinations we are able to give is totally dependent upon the amount of vaccine delivered to us. We remain in a position of uncertainty about how much vaccine we will receive in a given delivery each week. Even as vaccine is limited in supply right now, it is available across many sites in Howard County. Local health departments are but one source of vaccine. Persons living in congregate settings like nursing homes, assisted livings, and group homes for the developmentally disabled are able to be vaccinated by state contracted retail pharmacies, and this has begun. Other pharmacies will soon begin offering vaccine to prioritized groups, and the hospital will also vaccinate high-risk patients. I understand some are skeptical or concerned about vaccination. These vaccines are safe, highly effective, and were successfully tested on thousands of people from many different backgrounds using a transparent and rigorous process. Vaccine will help save lives. The more people who are vaccinated, the closer we come to returning to a more normal way of life. I hope everyone eligible takes advantage of this life-saving pharmaceutical. As the county executive mentioned, we reached a difficult and sad milestone over the weekend. We lost 200 members of our Howard County family. It is absolutely critical that if offered the vaccine, you take it. You will be protecting yourself and your loved ones. COVID disease is very prevalent in our community. We need to double down on our efforts to wear facial coverings, physically distance, avoid gatherings, and wash hands often until this is over. I understand the demand for vaccine is very high while supply remains limited. The Howard County Health Department is very efficient about utilizing all vaccines safely and effectively. Just before this event, we received an additional 3,000 initial doses for next week. Please be patient with us, as these doses cannot possibly reach everyone in 1A and 1B. We hope next week's shipment is a greater quantity to enable us to get to more people. Everyone will be vaccinated in due time. It will just take time. Please visit the Health Department website to sign up for information about how and when you will be able to receive your COVID-19 vaccine as we move into the next phases of this process. Thank you for your continued support.
Thank you, Dr. Rossman. Now we'll hear from Dr. Kate Hetherington, President of Howard Community College.
Good afternoon, everyone, and thank you to Dr. Ball and Dr. Rossman. I am so proud that Howard Community College has partnered with Howard County on such a critically important public health initiative to vaccinate residents. We are committed to this effort well beyond providing facilities. Our Health Sciences Division will help the Health Department with their vaccination distribution. We anticipate that our students will be involved in the entire process, from intake to vaccination to out-processing of patients. Several nursing faculty have volunteered as well. From the beginning of this pandemic, Howard Community College has answered the call to help. We've donated personal protective equipment and supplies to the county. Our Health Sciences Division graduated students early so that they can begin working on the front lines. Nearly every fall graduate of our nurse education program entered the workforce a full 3 weeks earlier, and an early graduation is planned for spring semester. Plus, our radiologic technology program is planning to graduate students as early as April. We have supported students with financial aid and hotspots. We have provided telecounseling to students needing mental health care and additional support for students experiencing food and housing insecurity. The college has taken every step possible to ensure the health, safety, and well-being of our faculty, staff, and more than 26,000 students enrolled at Howard Community College. This important work will continue when our spring semester starts on January 30th. I must thank the entire college community for their outstanding efforts in providing pathways to success. And thank you, Dr. Ball, for this opportunity to support Howard County and its residents. Thank you.
Thank you, Dr. Hetherington. And now Dr. Shafiq Ahmed, Interim President of the Howard County General Hospital.
Thank you and good afternoon. As my community partners have stressed before, we are in the middle of the second surge of this pandemic, and our focus at Howard County General Hospital has been to take care of the patients of this community and take care of people in the second surge. That being said, Johns Hopkins Medicine is actively administering the COVID-19 vaccines to personnel at Howard County General Hospital. We are one site as part of a healthcare system, and we have been continuing to follow a phased prioritization framework for administration of these vaccines. In our first phase, we distinguished two employee groups. Group 1 consists of JHM employees with varying degrees of patient contact, prioritizing those that are dealing with patients with COVID. We started vaccinating this group on December 16th of 2020. On January 8th, we actually started scheduling vaccinations for personnel from what we call Group 2. Group 2 for us includes Johns Hopkins Medicine employees who did not meet the criteria for Group 1, but who provide essential operational support necessary to enable frontline clinicians in delivering patient care. And I'm happy to say today, we will actually start vaccinating Johns Hopkins patients that are age 75 and older. Our process right now is by appointment only at any of our sites, and Howard County General Hospital is one of those sites for delivering vaccinations. Eligible patients in this category would be people that have received care with Johns Hopkins Medicine in the past 2 years. Over the next few weeks, individuals who meet these criteria will be contacted via email or phone when it is their turn to schedule a COVID-19 vaccine appointment in Epic MyChart, which is our method of managing patients through electronic medical record. Please continue to follow the precautions mentioned by Dr. Rossman. Although a vaccination is a light at the end of the tunnel, we are currently engaged in a fight with COVID-19, and it is incredibly important that you continue to support us by maintaining social distance, washing your hands, and continue to wear masks. We appreciate the effort, and thank you for the partnership.
Thank you, Dr. Ahmed. Jackie Scott, Department of Community Resources and Services.
Thank you, Angela. Good afternoon, everyone. I am pleased to be here on behalf of Howard County's Human Service Agency. Dr. Ball, thank you for your leadership in bringing us all together to fulfill this critical mission. I stand before you today representing a team of dedicated county human service professionals who are ready to come alongside Dr. Rossman and her team and all of the partners you see here today. We want to ensure that no person is left behind in our vaccination efforts. I recognize that we are all eager to get back to being able to gather in business, friendship, and community. This afternoon, though, I want to ensure our older adult neighbors, friends, and family members who have been identified as a priority in this 1B group that we are working diligently to ensure that you get the information necessary to register with ease and the information needed for you as soon as the vaccine is available so that you can access your vaccination. Our Office of Aging and Independence remains our direct service provider and outreach lead in the department for our older adult community. The office has been working and has been a constant presence and connection throughout this pandemic response for our older adults. Perhaps now more than ever, we know that you need us and you need to be assured that you are not alone in managing this phase of your health care. Our staff stand ready to assist you. Our bilingual staff have been deployed and are ready and available to assist those who have limited English proficiency. We have translated documents and information on our website and in flyers and hard copy in Korean, Chinese, Spanish, Chin, and soon to be Hindi. And we have resources available to assist those who are visually and hearing impaired. We stand ready and accessible to you to meet your needs. We also understand that not everyone has access to the internet, technology, or even may not be comfortable using it. We know that this is sometimes perceived as a barrier for people to access the services they need. Today, I want to assure you that this will not be a barrier to you in receiving the vaccination or in getting the answers that you need. You may reach out to our staff on the Maryland Access Point phone line to get a person who can assist you with the information you need. You may reach staff at 410-313-1234. We know that there have been many questions out there about how and where to get the information you need to make the decisions you need to make, and how to alert others about where and when to go online, to register, and to be able to receive the vaccine in a timely way. You will soon see more information coming into the community. We will use online resources. We also have signage and flyers that will soon be present in our communities. They will be shared throughout our 55+ communities, our senior resident communities and apartment buildings, our assisted living facilities, healthcare providers, and in our commercial areas. We will also be sending information out through traditional mail and even through COVID-safe, in-person, direct community engagement. People will be in your neighborhoods delivering information as soon as we can get it to you. Our goal is to make sure that our residents are equipped with accurate information about the vaccine, how to access it, and the details that help dispel any rumors about its safety and help to alleviate any fears that you may have. And we can raise awareness within the community with your help to make sure that everyone gets this vaccine when it is available. We are also working diligently now with through my Office of Children and Families, our vital link that has been working directly with our child care community to ensure that when those vaccines are available, you will get the information that you need on how and where to sign up and how to access that vaccine. Finally, we know that for almost a year now, our older adult neighbors, family, and friends have bravely fought against social isolation. They face challenges in accessing food and basic life necessities, and have managed through significant limits on getting the important physical activity and health and wellness activities that are so important to their daily well-being. You've done all of this to remain and stay COVID safe. We stand ready and fully committed to help you through this, and are grateful to our leadership for coordinating this important effort so that we can help each of you get back to living the healthy and vibrant lives that we all want to see for you. Thank you.
Thank you, Director Scott. And now we'll hear from our Howard County Public School System Superintendent, Dr. Michael Madarano.
Thank you and good afternoon. I'd like to begin by thanking County Executive Ball and Dr. Rossman for their continued collaboration and support throughout the entire pandemic. I'm excited by what today's press conference represents, as this is one of the first we have held in a long time that begins to point to the end of this pandemic. The impact of COVID-19 has certainly placed K-12 schools at the forefront of conversations about what should be open, what should be closed, and how to implement processes to manage large numbers of people inside of buildings. I have continued to reiterate since the start of this pandemic that educators are essential employees. I am pleased and grateful that educators have been included in Phase 1B of the vaccine distribution process, as that speaks tremendous volumes and importance that educators and schools have great on the community. I have great confidence that the distribution of the vaccine will help lower our community cases and keep them low enough to fully reopen our school buildings and our doors and keep them open. We are not in the clear yet, but we are finally headed in the right direction. Until we get our county metrics at the level that are acceptable, we will be unable to provide the kind of face-to-face support that our students deserve and our educators want to provide. Throughout this process, I have worked very closely with Dr. Rossman, and our staffs have been communicating daily. The planning of the vaccine distribution in Howard County Public School System staff continues to be a coordinated effort between the school system and health department that will continue in the days and weeks ahead. Our school nurses and health assistants will be receiving training this week on how to administer the vaccine and will be supporting the process to vaccinate our staff and community. The Howard County Public School System has developed a very clear prioritized grouping of employees to receive the COVID-19 vaccine as we enter now into Phase 1B. Each staff member will receive an email with a link to sign up for their vaccination, one tier at a time. The 4 tiers include school nurses, as I've already stated, and health assistants who will receive their first dose as part of the training when the vaccine becomes available. Staff who have been working in person, this includes custodians, food and nutrition service workers, members of the operations and technology department, school-based staff, job categories that have been identified to support the return of small group instruction, and contracted bus drivers and bus assistants. Phase 3, all of our school-based staff, including current substitute teachers. And Phase 4, all other non-school-based staff. I must reiterate that this plan and all plans moving forward will be solely dependent upon the availability of the vaccine in Howard County, as stated previously. We will be ready to distribute to our staff, but only can distribute the vaccine as quickly as we receive it, and I urge all individuals in our school system to be patient. Again, thank you, Dr. Ball, thank you, Dr. Rossman, for your considered support and collaboration as we continue to navigate this unprecedented pandemic. Thank you very much.
Thank you, Dr. Madarano. Our final speaker today is Fire Chief William Anashevsky.
Thank you, Angela. Thank you all for being here. I'd like to once again thank Dr. Hetherington for access to this wonderful facility for such a great cause. The department's mobile integrated community health team has been integral in our response to the COVID-19 pandemic. From the onset, we have been in a response mode, and you have previously heard me speak about our rapid response teams, our decontamination teams, our follow-up in-home visits for those who were symptomatic or COVID positive and chose to convalesce at home. And more recently, the sample collection for the public safety personnel antibody testing program. Today, we are proud to announce that we will be once again pivoting our team to assist the health department with the vaccination process. A key strength to our mobile integrated community health team lies in the first word of its name, mobile. The team's ability to move from location to location to access patients or groups of individuals who may not be ambulatory will help in the vaccination of this great at-risk group. Currently, this program is in the final logistics planning phase to determine facility and location needs, the logistical needs between the health department and the Department of Fire and Rescue, and we anticipate finalizing these plans in the coming weeks. The biggest unknown, as you have already heard here today, is the availability of vaccine in Howard County. We look forward to bringing this program online to better serve all the citizens of Howard County. And it's somewhat inconceivable to think that in just 2 short months, we will be at this for 1 year in Howard County. The vaccine is a light at the end of the tunnel, and we ask that you all be strong, and we will get through this as one community. Thank you.
Thank you, Chief Anashevsky, and to all of our speakers today. Now we'll open it up to the press if there are other questions. Sure. If you could please clarify who is able to register at this time.
So right now for Phase 1A, and I'll start off and then Dr. Rossman can clean up anywhere where I may have erred. Phase 1A, most of those individuals have been contacted, many through different boards and where they hold their licensure. Phase 1B, pursuant to the governor's guidance, has started being prioritized with those 75 and older, and that's where we initially launched our website for registration. This week, we will be expanding that registration to everyone who is eligible to be in Phase 1B. In Phase 1C, we have started with those who are 65 to 74, and right now, because of such limited supply that we've gotten, we're going to continue to focus on 1B at this time while we allow those older adults in 1C to register. Dr. Rossman? All right. I got an A from the doc.
Other questions? Yes.
I'm not press, otherwise Steve. Okay, so my question is, in the paper it indicated Giant Pharmacy will handle as well distribution. How is that effort coordinated with the county?
Please clarify what the role of the pharmacies have in Howard County and which pharmacies.
So the question about clarifying retail pharmacies and how they are assisting in the vaccination in Howard County. So currently, CVS and Walgreens are contracted with the federal government to provide vaccinations in congregate facilities. This includes our 6 nursing homes, many assisted livings, and group homes. I understand that Giant Pharmacies will also begin receiving distribution of vaccine to pilot vaccination in supermarkets, similar to how flu vaccine. I don't know when that program will begin.
Thank you, Dr. Rossman. Any final questions? Seeing none, I want to thank everyone who's here today, those who are joining on Facebook, and to all of our press and our community. Thank you, and this concludes our press conference.